So did you guys know, here's a fun fact, did you guys know that 5.7 million Americans are currently living with Alzheimer's today? That is a scary amount of people. I don't care if you work in labor and delivery, pediatrics. I don't care if you don't see any elderly folks at all at your job today. I know at the very least throughout your clinical careers, for you nurses out there, during your nursing career, during nursing school, throughout your clinicals, you must have had a patient that had Alzheimer's or dementia, or someone in your family that has Alzheimer's or dementia. It's a scary disease. It's horrible, right? So for all of us nurses, for all of you human beings out there that know someone that has Alzheimer's or have taken care of someone that has Alzheimer's, you know the frustration. I'm not going to stand here and pretend that it's not hard to take care of someone with Alzheimer's, right? They have all these symptoms. They're hearing things, they're seeing things, they're confused all the time, and you can't help them because you don't know exactly what they're going through. And yeah, you don't need to know exactly what they're going through to give quality care, but it is nice to at least understand what someone is going through, because that is the key. If you can understand how they feel and the way they are feeling, then you can try to remedy those issues, right? And I truly do believe that this technology is that doorway for us to get to that place, right? So leaders in Chicago Methodist Senior Services hope to train all of their workers with a program from Los Angeles-based Embodied Labs. And what is this program? It's a program that basically allows you to be someone that has Alzheimer's. It's that simple, right? So the way Embodied Labs happens, so Embodied Labs CEO Carrie Shaw developed the prototype of the program as a graduate student at the University of Illinois, Chicago in 2015 and 2016, inspired by her mother who had early onset Alzheimer's. She said the program has trained more than 2,000 caregivers across 50 organizations in 14 states and 4 countries. Empathy is the name of the game. You know, we've all rolled an ankle, so I kind of understand what it would be like to have a shattered foot. You know, understand what it would be like to have some chest pain and have a heart attack. You can understand all of these physical ailments, but when it comes to mental disorders, it's much harder. It is much harder to pretend to know what it feels like to have Alzheimer's, to have dementia, to not know who your family members are. You can't, it's hard to comprehend, but this virtual reality allows you to sit in a body of someone that doesn't and experience it, and I love it. I mean, the patients, the caregivers that have gone through it have said it's just done wonders. It just opens the door to just understanding and respecting and empathizing with these patients. Thank you guys so much for watching. I really do appreciate this. If you guys were informed or educated in any way, shape, or form by these stories, please hit that like button. If you liked my presentation of the news, I really suggest you subscribe and hit the notification bell so you know every time Q the Nurse drops some hot, fresh press news. Thank you. Catch you next week. Deuces.